don't hear you saying anything.
All right, Miss Shapiro. I'm going to put your catheter in. Is that all right? Okay. Just relax. It shouldn't hurt. Just maybe a little uncomfortable.
Please stop. What didn't you do? Hi, I'm Kathy. I'm your nurse today. The doctor said he wants you to have a catheter. Can you just confirm your name and date of birth? No. Okay, fine. I'm just going to wash my hands and then I'll get set up. Okay. She still didn't get what I was getting at. You didn't wash your hands.
Oh, well, I thought...
No, you have to do it exactly like you're going to do it, because if you don't do it when you're practicing, what's going to happen, ladies and gentlemen? She won't do it when she's doing it.
Okay.
You don't have to knock and walk in, but at least wash your hands first. And I would do the whole thing, because you're going to forget to do it.
All right, so I'll do the whole thing. Hi, Miss Shapiro. Your doctor said that you have an order for a catheter. Is that all right? Okay, I'm just going to check your name and date of birth. Okay, let me go wash my hands.
We're going to assume that she didn't do that yet. So down up.
Well, yeah.
Unless Miss Shapiro is strange, which she never knows.
Yeah.
Now, would you have the gown up before you start doing this or not?
Do it however it tells you in the thing. I don't want to tell you the way I do it, because you'll get confused. Just ask yourself, would you want to be laying there like this while somebody putzes around with the box? I don't usually. Oh, isn't that cute what she did with the flowers?
So the sterile field's going to be down there.
Don't look at me. That's what I don't want to tell you differently. That's what Miss B showed you, so I would just do it the same way she did.
Okay.
Do you have a place for your trash?
Yeah, right here.
Can you touch that? Okay.
All of that was in there, so all of that is sterile.
Can you use that little plastic cup thing? Anything you're not going to use, get rid of it. Get it out of your thing.
Okay.
Just pick it up and toss it to the sides. It'll mess you up. Leave it on. Leave it on.
Alright, I don't have any lube in my kit.
We pretend.
It's not going to go in. And it won't go in. Great.
Yeah, you're doing it. Want to email it? Did you hear it? Good idea. I'm just making sure that all of these packages we have sterile gloves on when we open them because they're all sterile. Right? Okay.
Now you can lubricate that up now with both hands. It's not going to hurt anything, so the inside of the box gets goofy. Who cares? And then you're ready to go. You don't have to do it when your one hand is contaminated. Okay. That can stay inside the box. If you're on the outside, you run the risk of contaminating. Just lay it in there. Difference doesn't make if it's...
It's all sterile.
Doesn't matter, yeah. You'll just wipe off the tubing when you're done if it gets all over the outside tubing.
So you're going to feel a little bit of pressure, but it shouldn't hurt. Just take a deep breath.
Is it not going in?
No.
To open that little hole. Let's just say you got urine back, okay?
Okay.
Now, it's going to slide right out if you do that. If you leave your hands like this,
Mhm.
it's going to go like this.
Okay.
Let me poke on that face. Get that too. Because it's a mucous membrane, remember? The mucous membranes are slippery, so if you don't hold on
So
to
you
it,
did the
it's going to
inside,
slide right out of it.
middle? I thought it was
Outside, outside.
So you did it on the outside of the bladder?
Because the thing is, the urethra is what's dirty, so that's why you do that last.
Right, but I mean, like, she did the actual, like, outside of the lips or, like, the inside of the lips?
Oh,
And then,
The inside.
I couldn't tell.
Side.
Okay.
Urethra and then.
Okay, now you should be able to.
Okay.
The only other thing I'd do is when your hands are sterile, I would move this up closer to the patient.
Okay.
The farther you are away, the more likely you are to contaminate something. Okay. Is it going in?
Yeah.
It's not that hard on a person.
Okay.
Okay. You have to do this. Take these fingers and take those fingers and do that.
Okay.
Hang on to that.
Okay.
Because if you don't, it will slide out. Okay, now you can let go. Okay, now you're good. And don't tug it that
That hard?
Just
Okay. Well, she said to try it. Make sure that.
yeah. If you've got an old person, it's going to go right into the urethra. So I would just, if you're going to just barely, you don't really need to, because once again, it's a mucous membrane. The mucus lining in the bladder will cause that little balloon. Here's my balloon. Here's my tubing, and here's my bladder. It's going to float, and it's going to stop. So you don't have to tug on anything. If you saw urine, it's in there.
Okay.
And just be careful when you're handling these things that you're not,
Pulling it.
yeah,
Yeah.
I would hang
it
on to
down.
something. Yeah.
Okay.
And what are we sitting it on the side of the bed? Where are we putting it?
This little hole that's right here.
Are we putting it on the side rails?
No, because it can get caught.
And then how do you secure that? What do you do to secure that?
You can get like tape.
A strap. Let me get
or-
your strap.
Okay.
I got a bunch of you guys can practice.
Yeah.
Huh?
As long as you're not tugging on it. There you go. And here's 4 more so you guys can practice.
Should we strap before we hang?
Doesn't really matter. It'd probably be a better idea only because you've got to get it around that little loop thing.
Now at this point she's all unsterile, but that's okay.
Yeah, you're not touching anything sterile anymore. You're all done.
Okay.
Once the balloon is blown up, you're done being sterile.
Yeah.
Yeah. You want to make sure that there's a gap. And give a little bit
A
so
little
that they
bit,
can
yeah.
bend their knee and it's not gonna. And that's all. You can always, if they can move their leg, bend your leg for me, and then you'll know how much you should give it.
Okay.
Also, whenever we
And
go,
this should be turned in here this way.
Turn towards the inside.
Yeah.
All right.
There you go. Sorry.
Okay.
my question was at the beginning, she just spread the legs. Should it be spread and should it be like that, like knees up?
If you can
like,
do a froggy position, that's
We
fine.
need froggy.
Once again,
or we need spread.
it has to go like this. Turn it like this. If you can do that with
Okay.
your patient, that's fine. But a lot of times you'll do that, you're putzing around doing this stuff, and the leg goes like this.
Okay, so,
So,
don't even worry about it.
Yeah, on a female patient, it's never going to be this easy. Female patient, you got to get in there, especially if it's a heavier person. You got to get in there. Sometimes you got to raise up their belly. You got to really get in there. So, if you have to position them, what if they've had a stroke on one side? You can't maybe bend that leg. Just do one leg. Try and get at least one leg good. Okay?
So for Wednesday, we should try to frog
Frog leg. Just do the frog leg because that's what she should do. Whatever she showed you how to do. I know she said there's different ways of doing it. Just do what she said, just to get through the competency. Because when you get out there, each patient is
I
different.
know.
They're all
Anyone
different.
remember what she said, frog?
Yeah, she said in I remember. I saw her do that.
Okay.
I can teach you if you guys ever want to learn a sideline method. Works great. Especially on people that are old or that are heavy, very heavy people, because it gets all the fat out of the way because they're laying on their side with their leg up, and everything just kind of opens up and you can see everything.
So technically, the proper time to have raised the thing would have been after you check the pump, and then you're gonna be ready to raise the gown. Or no, because you're already sterile then.
What I like to do is I get everything pretty much set, and then I can go
Right before you.
I
put
can go
your
like
gloves on.
this, because this hand is going to be contaminated. You can go like this, and then like that. This way they're not completely exposed, all right? And then like that, because you've already contaminated the glove anyway. Sometimes if they're old, they're cold, they got their legs like this, and they're cold, and it's taking you a few minutes to get ready, you can cover the legs up, right? If they need a cover up across the top of here, so that the only thing you're exposing is this.
Well, where, if you do that, where would you put all your sterile
Right
stuff
here.
over here? You'd still just fit it in there?
Yeah, why not? Because they're cold. You got to think about your patient. Because let me see. Let me do that. In the past, we would actually wrap blankets around their legs. Every patient had that. And then, let's see, we got this. And then I'm doing this. Okay. Well, this one doesn't come out, but that's still, because that's not in there yet, right? That's still sterile. So you can cover, if a person, let's just do her legs the way she had them, just straight like this, okay? And we cover them up.
Then it would work.
You still have your, you can do that. Doesn't interfere with anything.
And as long as the inside of the sterile field isn't touching anyone,
As long as nothing in here is touched except with sterile, you're good. This doesn't matter.
You don't, so like the top of, sorry, Christine, the top of this, like if that.
Doesn't matter, you've got an inch, you've got it, as long as you don't have it like up here, where it would be against the less than an inch. No, if you have it in the center here, you're fine. Because that's more than an inch, that's more than an inch, that's more than an inch. So you're fine. Even if you turn your thing like this, because you'd like to turn it square, if you do your thing square, like that, same thing. You're good. But actually, the way she does it, if you're going to use this as your thing, which I never do, if you're going to do that, this works like that. And once again, I don't do it this way only because I'm used to older patients. Older patients can't hold their legs out. They can't cooperate with you. You might have someone who has dementia and they're kicking their feet. I don't want someone kicking their feet when I've got my sterile field here. So that's why I don't usually do it this way. Miss B works with young women. They're in labor for 5 seconds. They can hold their legs apart. They're probably up in stirrups, right? Anyway. So you have to think of her reference point versus my reference point. It's a little different with someone older or a kid. If you got to do a kid, I would never put my stuff here.
No.
It would always be here because the kid's going to be flying, you know. You might have to mummy him. So, but you did fine. You did good.